Have you ever uttered the words, "It is what it is," out of frustration, contentment, or defeat? Northeast Delta Human Services Authority's radio show entitled, "It Is What It Is" will address the individual systems we all encounter while journeying through life. Be it mental, emotional, physical, or social, this show gives perspective on navigating the process of being and becoming your best self. Moderated by co-host and Public Information Director Tanil T. Terry, along with co-host and Executive Director Dr. Montek A. Sizer. Now it's time for It Is What It Is. Good morning, good morning, good morning. Happy Friday, April 27th. This is actually our Season 2, Segment 12, our last Friday show for April. And welcome to It Is What It Is. I'm your co-host, Tanil T. Terry, along with co-host Dr. Montek A. Sizer. Good morning, Dr. Sizer.
Good morning, Tanil Terry.
How are you this morning?
I am doing great.
Wonderful, wonderful. And good morning to all of you out in Radio Land. Today's topic is the effects of incarceration on persons with addictive and mental disorders. So that's a pretty heavy topic, especially here in the state of Louisiana. So those who are just tuning in and are listening in, if it's your first time, or even if you are a veteran and you listen in to us every single week, as you know, it is what it is. We seek to give voice and a new outlook on those battling and seeking to overcome challenges associated with poverty, mental illness, addiction, and developmental disabilities. We also take systems and we give a different perspective and ways to navigate through systems, and we highlight and figure out some of the broken pieces of those systems and ways to get around that, because we all know and understand we're all journeying through this thing called life, and we all just need a little bit of help and a little bit of encouragement. And so that's what we strive to do here on It Is What It Is. So jumping right into today's segment, the effects of incarceration on persons with addictive and mental disorders. At any point in our time in the broadcast, if you'd like to call in, if you have something to say, like to share a story, you can call in by dialing 318-324-1500. Again, the number is 318-324-1500. As we do every single week here on the show, we clearly define the words that we are discussing. So, Dr. Size, let's jump right in and let's define disorders, addictive and mental disorders.
All right. Addiction is a complex condition, a brain disease that is manifested by compulsive substance use despite harmful consequences. People with addiction, substance use disorder, have an intense focus on using a certain substance, such as alcohol or drugs, to the point that it takes over their life. They keep using alcohol or a drug even when they know it would cause them problems. And according to the National Institute on Drug Abuse, people begin taking drugs for a variety of reasons, including to feel better, i.e., feeling of pleasure, high, to do better, improve performance. Some of them do it out of curiosity and this simple peer pressure.
Okay, so addictive disorders, I'm going to just kind of sum it up. So you know Dr. Sizer he's going to speak in psychologist terms because that's his background, his profession. So just keeping it in a little simplified terms, addiction, it's basically an intense focus on using a substance or thing that the individual, even though they know the consequences, it overtakes and it's more powering than the negative consequences of using that thing or that particular substance.
That's a good refrain, but when we're speaking about specific disorders, we've got to talk about it as it relates to a diagnosis. And talking about it from a diagnostic standpoint, these particular points are very, very key to make. So I really want the audience to understand that as a clinician and as those who actually provide treatment to these individuals for these types of ailments, they have to know what those key components are. And so now I'm going to jump to mental disorders. A mental disorder, also called mental illness or psychiatric disorder, is a behavior or mental pattern that causes significant distress or impairment of personal functioning. Mental disorders are usually defined by a combination of how a person behaves, feels, perceives, or thinks.
So different mental patterns that's defined by a way a person behaves, sees, or thinks, and just kind of jumping in are a lot of times certain things are easily identifiable. Sometimes you can see someone walking. Let's talk about physical ailments. If you see someone walking with a limp, then it's obvious that at some point something happened. There was some type of obstruction in their body, their limb, or something happened, or even a deformity of the face or the eye, or something like that. But with mental illness or addictive disorders, they're not always so easily identifiable.
Uh, Even in that example that you gave, all we see is a limp. We don't know the causation to it. It could be that they were shot in the war. They could be that they have some sort of a neurological sort of deficits. It could mean that they had some other type of organ type of challenge that's caused them to have drop foot. And so just because we see a thing, the causality relative to it could be many.
Sure.
Same with mental illness. It's because we see a person behaving in a certain way, we don't know what's causing it. It could be a physiological issue, for example. Somebody could be a diabetic and not take their insulin, and as a consequence, start to hallucinate, start to see things that typically they would not see if they were on their insulin. Or they can have a psychotic break, or they can be dealing with issues of schizophrenia, where it's still a biochemical process, but it's causing them to do things or speak out of turn or hallucinate in a way that they would ordinarily if they had their dopamine and other types of neuroreceptors in balance or on their medication and or in treatment. And so when we talk about physiological issues and or mental health issues, oftentimes these things go hand in hand, and oftentimes they can mimic one another. And so being a good diagnostician helps to break out or determine what's the likely cause or what the likely issue would be. Because in the manual that psychologists and psychiatrists and LCSWs and others use, there are a whole number of disorders listed. And so there are different categorical fields in which people have to assess to try to come up with the proper diagnosis and then devise the appropriate treatment plan for individuals who may be suffering from a mental illness and or addiction.
Absolutely. And for those of us who are professionals that don't work in the medical field and don't have that particular background and aren't able to properly diagnose, and this is one of the where some of the issues are coming into play, even with law enforcement and others. We can all think about, or we've all experienced just even driving through the neighborhood, or we all know someone that's in their neighborhood where there may be a person just exhibiting maybe strange behavior where they're talking to themselves and they're just maybe walking in circles or doing something similar to that, just odd behavior. And if someone calls the police or the law enforcement as a concern, and if law enforcement comes out and they haven't been properly trained to
Mm-hmm.
diagnose these type of they don't have that background to know that these type of mental illnesses exist or to the things to look for. So when these things aren't easily identifiable, then it could be that person could be categorized inappropriately.
Certainly they could, but I think all of us can recognize when somebody's a little off. But the reasoning as to why they're off oftentimes requires a different set of diagnostics or understanding of their social histories and having a conversation with them to really try to distinguish what may be going on with that person at that time. And so, using that example, should a law enforcement officer be called to the scene and they see somebody acting bizarrely, it is possible that they recognize something is happening, but they don't know what it is. And so, law enforcement officers are typically trained to serve and protect, and they want to go home to their families at night as well. And so, when they issue
Absolutely.
commands to someone who may be having a psychotic break, it's not likely that those individuals who are suffering from that psychotic break will obey their commands. And should those individuals seek to raise an object towards a law enforcement officer or seek to charge a law enforcement officer, one of the natural reactions that they will have is to protect themselves or innocent people who may be standing around. and therefore they could shoot and or kill a person with a mental illness. And so this is why it's important for us to have this conversation today, and it's important for law enforcement officers to be trained and know how to identify some of the signs and symptoms of not only mental illness, but also those who may be impacted by a substance, because a substance can also alter behavior to the point in which they may not always obey commands of officers. And so, and as a consequence, there could be some tragedies and some negative outcomes just due to misunderstanding as to what it is the officer may be confronting by way of somebody with the mental illness and or addiction.
When we talk about the effects of incarceration of persons with addictive and mental disorders, we can't help but to think: can a person? The question has to be raised: can a person with a mental illness or an addictive disorder be adequately helped while they are incarcerated? Can they get the appropriate help, not just the being incarcerated for the time and do serve their time, but get the necessary mental help or go through the process for that individualized help that they need?
Let me say that there are many phases of incarceration, and there are different jurisdictions associated with who incarcerate which type of prisoner. You have local jails that's primarily managed by the sheriffs. You have state facilities, and you have federal facilities. Each of those facilities will provide a different type or level of care. You typically get more services at the federal level than you do at the state level and that you do at the local level. Jails or local parish jails also house a lot of state inmates.
Sure.
But when state inmates are housed at local jails, they don't get nearly as many treatment options as they would get in a state facility. Now, state facilities also contract out to private providers, and sometimes those private providers don't provide sufficient mental health treatment. But suffice it to say, nobody is better off or gets when they go to a situation like a local, a state, or federal prison. Oftentimes, those settings exacerbates or magnifies the issue that a person with a mental illness may have or addiction may have. And oftentimes in those settings, there is a breakdown. There's suicidal ideations. There's feces smearing and urine smearing. Oftentimes, these individuals are attacked by other inmates. And then because guards and others don't know how to treat them, they resort to isolation tactics and things like that. To protect the patient who may be suffering from an inmate who is suffering from mental illness and or from themselves and or others.
So what factors or what considerations do you think that should be taken when you're talking about housing an inmate with a mental disorder or an addictive disorder? Because if there's a disconnect there mentally, it's not in the best interest to place that person in general population, because they may not be able to defend themselves, or they're not mentally adept to be able to engage like everyone else. So there are so many other different factors that could be just an accident or just a bad situation waiting to happen. So what are some of the considerations that you think should actually go into properly identifying, assessing the inmate and placing them?
Yeah, I would say that having, before a person is even arrested, having sufficient community capacity, institutional bed capacity to deal with people with mental illness and or addiction. Addiction and mental illness is best treated when they are in settings where you have professional individuals that the patient can be stabilized and proper treatments, both psychotropic medications as well as some therapies and the like can be properly applied. And hopefully that's best done in communities and not in jails and or prisons. But should they be arrested and and have to deal with a jail or prison environment. One of the first things that prisoners should, I mean, one of the things that should happen would be for those jails and then those state facilities to do a proper assessment to determine what the severity of the challenge may be. Once they identify what the severity is or what the type of health ailment or mental or addiction challenges they're facing, provide proper care so that these individuals can properly adjust while they're in that sort of environment. But we all know that those environments are not equipped to deal with somebody with severe mental illness and or addiction. And as a consequence, as I mentioned before, the challenges that people go into those facilities with are oftentimes magnified. And as a consequence, they are victimized, and they also have a tendency of hurting themselves and maybe others.
According to prisoner health, the in the U.S., 2 million people with mental illness are booked into jails each year, and that's quite a bit when you talk about mental illness as a whole. And we struggle with it even in our day to day lives and um, just in general. So when you talk about a prison population where inmates often there isn't sufficient coverage, or you have 30 inmates to one guard, or even the numbers are a lot higher, just being able to have the sufficient coverage to be able to make sure ensure that negative things don't happen in jail. We've all heard of horror stories where things do happen, regardless of all the systems and the things that are in place. Things bad things do happen, and
Hmm.
those who can't protect themselves, when you talk about a mental illness, they would fall under the category of not being able to sufficiently protect themselves.
Right, and not only that, the prison guards and administrators are not equipped to handle them. And there are so many challenges at a jail and or facility. They want to do the right thing. They recognize that there are things that they would want to do, but just don't have the ability or resources to provide to help the person with a mental illness and or addiction. Um, and so, as a consequence, they are also frustrated. They recognize that the facilities that they operate, certain individuals shouldn't be in them. The people who actually commit heinous crimes and those who knew what they were doing at the time in which they committed it, they're the ones that they want to have in their facilities, not the persons with a severe mental illness and not the person who is suffering from an addiction. And oftentimes, mental illness and addiction co occur. And so it's not just one situation that they're struggling with. Oftentimes, they're struggling with two or multiple things because they're polysubstance users, meaning they use more than one, they make more than one substance. They may use heroin, for instance, then they also may drink alcohol, and they also may use meth, and they also may be majorly depressed. And so oftentimes those things are co-occurring, and when they do, and when they go to a place like a jail or prison, you can see how those facilities are not equipped, and as a consequence, the best they can do when a prison or inmate is doing something or not following orders is to isolate them and or treat them the way they would treat another inmate. And as they do that, they again exacerbate, magnify the challenge that a person with mental illness is suffering from. Now, one of the worst things to do is to isolate a person who's having a psychotic break, and oftentimes, or constrain, and oftentimes that's the only way prisons have to deal with a person without having adequate resources in a facility like that. They restrain them, they isolate them, they take their clothes, they put them in a paper gown. And so being in a small room for a long period of time when you're already having a psychotic break, you can imagine what you're getting. So that's the challenge. That's the challenge. And when you think about the number of prison beds that this state operates, and it is it incarcerates more people in any place in the world. And you juxtapose prison beds against inpatient psychiatric beds, you see that the inpatient psychiatric beds have decreased significantly, and we've had a boom or expansion in incarceration. The two don't mix, and there is a correlation between no inpatient beds and the growth of the need to incarcerate more and more individuals. So essentially, jails and prisons have become the new asylum for people with serious mental illness and or addiction.
There's so much to be discussed on the effects of incarceration on persons with addictive and mental disorders. If you are listening right now and you'd like to chime in or you have a question or comment, you can give us a call at 318-324-1500, 318-324-1500. It is what it is. We're talking about the effects of incarceration on persons with addictive and mental disorders. Looking at, I have so many notes here. When like this is a really, really heavy and touchy subject, especially being here in Louisiana, and we're going to, we actually have a special guest joining us in just a few minutes, and I don't even want to. What time is it? We have just a couple more minutes. We can finish discussing before we bring them on, Dr. Sizer. But when we talk about even the role public policy plays to combat mental illness and the incarceration pipeline, you discussed on different levels and the financial pieces with those different levels on what type of services and how much coverage is available depending on what level of care. And so a lot of this is political, and a lot of it does kind of boils down to what's the budget for each all of the different entities from a local level, a state level, as well as a federal level.
It is, and so as you said, it comes down to public will. What is it that we really want to do to address this significant situation? And when you think about the causes or the correlates to the high incarceration, and this is what I mean. My recent look at DOC's population or demographics, 80% of those who are in DOC had a addiction problem prior to incarceration. When I also looked at the graduation rates, 80-some-odd% of those who are currently housed in DOC, Department of Correction facilities, didn't graduate from high school. So there's a high correlation between non-high school graduation and incarceration. I mean, it's been known for years. And so when you talk about public policy, we got to get the schools right.
So starting or catching it earlier.
Or making sure that people have better training and better educational opportunities so that they have more pro-social things to engage in, as opposed to selling drugs or opposed to losing hope because they don't have a way in which to take care of themselves or family. The other thing is that we've got to have more inpatient beds, because if we don't have sufficient inpatient beds, then where are people are going to go if they can't be treated in community-based service options? They'll be on the streets. They'll be running into hospitals and not getting adequate treatment there because hospitals are not even equipped to deal with serious psychiatric and or addiction-related challenges. And so we have to have more inpatient beds. We got to have more community providers. We've got to have more housing for individuals, more job opportunities for individuals. And yes, people have to also learn to take advantage of these opportunities when they're available. So they have to also learn to make better decisions based on the rules and norms of society at the same time. And so these public policies are very, very nuanced, and they can go in multiple ways. And so there are too many to be named, and I think we'll have to, delve down into these subjects a few more times to really tease out what I think would be most appropriate for our listeners dealing with this complex issue.
It's definitely a very complex issue. And if you're listening, once again, you can call in if you have some questions or concerns, or if you'd like to voice your opinion, 318-324-1500. We're going to take a quick break, and when we come back, we'll be joined with our special guest, and we'll be discussing the Louisiana Reentry Program, LARE. So stay tuned, and we'll be right back with more of It Is What It Is.
You're listening to Northeast Delta Human Services Authority radio show, It Is What It Is, with Tennille T. Terry and Dr. Monte A. Sizer. I was in a very low place in my life. I got help and found happiness.
Addiction was taking over. Now I'm in control of my life.
We were about to lose our house.
But now, we enjoy making better financial decisions.
At Northeast Delta HSA,
Transformations are happening.
from the way we provide integrated care,
To the many services and programs we manage.
help is only a click away.
Visit our website, www.anydeltahsa.org, to find the help and services you need. Northeast Delta Human Services Authority manages the operation of community-based programs to improve the quality of life for individuals with major mental illness, developmental disabilities, and addictive disorders.
We utilize a nationally recognized integrative approach that identifies and addresses both behavioral and primary healthcare needs.
Our agency operates through collaboration with regional partners in business, prevention, education, and care throughout Caldwell, East Carroll, West Carroll, Ouachita, Lincoln, Madison, Franklin, Morehouse, Jackson, Tensas, Richland, and Union parishes.
Northeast Delta HSA is devoted to delivering programs and services that encourage citizens of Northeast Louisiana to reach their full human potential.
3 tenets guide these efforts: excellent customer service, greater access to services, and competent quality care.
For more information, visit our website at www.anydeltahsa.org.
How can I tell my wife that I won't have the money to cover our mortgage again?
Hey, Mom, you think I could borrow some money again today? I have some bills to pay.
I know I shouldn't take any more money out of the ATM, but I'm so close to winning, right?
Are these examples of what you say to others and yourself just before gambling? When gambling causes you to lose everything, it's more than just a game. Phoenix Rising is a new gambling initiative created by the Northeast Delta Human Services Authority that offers free treatment, education, and prevention services for Louisianians who exhibit a problem gambling. If gambling has begun to affect your personal life or someone you know, please contact your local gambling coordinator at 318-331-8270. 318-331-8270. Phoenix Rising, created by the Northeast Delta Human Services Authority.
According to the Centers for Disease Control, 24% of Louisiana smokes cigarettes. Smoking is the leading cause of preventable death in Louisiana, taking the lives of 6,500 Louisianians a year. At Northeast Delta Human Services Authority, we are inspired to catalyze and transform the lives of Northeast Louisiana citizens in our 12-parish region through our tobacco cessation program. This program provides cessation counseling, nicotine replacement therapy, tobacco screening, and non-nicotine medication. To find out which of our 7 locations is nearest you, or to learn more about our tobacco cessation program, visit us online at nedeltahsa.org or call 318-362-5342. That's 318-362-5342.
Northeast Delta Human Services Authority, with locations in Monroe, Ruston, Tallulah, Bastrop, Winsboro, and Columbia. 318-362-5342 and online anydeltahsa.org.
Steady trying to find the motive. Why do what I do? And freedom ain't getting no closer. No matter how far I go, my car is stolen. No registration. Cops patrolling. And now they done stop me and I get locked up. They won't let me out. They won't let me out.
And welcome back to It Is What It Is. We're joined now with our special guest, President and CEO of Goodwill Industries of North Louisiana, David Tinkis. Good morning, Mr. Tinkis.
Good morning.
How are you?
I'm doing great. How are you guys?
We're wonderful. So we have Dr. Sizer here, David, and also we got David calling in actually from Shreveport, Louisiana, right?
Yes, ma'am.
Wonderful, wonderful. So we've been talking about, I don't know if you've heard, you got a chance to catch first half of the show. So we're discussing the effects of incarceration on persons with addictive and mental disorders. And I know that Goodwill and Northeast Delta have partnered up together to do some great things and to present a solution to the recidivism. And one of those solutions is the Louisiana Reentry Program, LARE.
Yes, we are very excited about this new program. We've been working very closely with the Human Services Authority to address this very important issue. When you look at the fact that the 5-year return rate for returning citizens in Ouachita Parish, it's 44%, and so it's a problem that needs to be solved, and we want to help people get reestablished in the community, and the program really is set up nicely to provide those services.
Okay, so let's just kind of talk through the program for those who are listening, and let's break down exactly what is this program, the Louisiana Reentry Program, LARE.
Sure. The program is evidence-based, and it's a comprehensive case management and service coordination program for returning citizens that are coming from correctional centers in the parish and that are in need of behavioral health services. And what we want to do is we want to help the participants identify and remove any barriers to their success, and we do that through discharge planning and case management support. And one of the first steps that for success is to have a plan, and this has to happen before the person is released, and that's going to ensure that there's going to be a successful reentry. And we look at everything from, where's the person going to live, where are they going to work, and acknowledging, any other types of needs of assistance or barriers that need to be addressed, and those could be temporary challenges, and some of them could be long care, or long-term, things like health care, both physical and mental, their education, employment training, all those areas have to be addressed, and we really leave, no stone unturned, because we know that the more intensive the case management with each individual, it's going to better ensure that they're going to be able to get reestablished in the community. The other part that we work on, this isn't something that Goodwill does alone. We recognize that there's tremendous resources in our community, and it's kind of our job to help that individual connect to those resources. And so it's really a collaborative effort in the whole community, and the whole community kind of embraces that person to ensure that they can stay in the community and become a productive citizen.
And becoming a productive citizen. So with the case manager, the case manager isn't paired with the individual once they're out of the system. They actually they're paired with them months prior to their release date, correct?
Absolutely. We typically try to start working with a participant at least 90 days prior to their release, and so this is a relationship that we build, within the correctional center, and then carry that out once the person is released. And so really a lot of the planning and the hard work is done while the person is still incarcerated, and really, we kind of, again, try to identify all the potential needs and make those connections prior so that the person is ready for success the minute they walk out.
And I'll also add that certainly we're not Pollyannish to think that everybody who comes out and enter this program will be successful, because a lot of it's predicated upon having sufficient community resources. And so having a plan, having an outstanding case manager, having behavioral health and substance abuse treatment options and the like, those things are great. But we're not tackling issues of housing. We're not addressing educational issues or challenges. We're not in their homes. We're not in their heads in terms of when they go back to environments that created the toxic sort of set of things, challenges, behaviors that created their disability and or arrest challenge. And so it requires a holistic approach when we're dealing with these types of individuals in this specific issue. But what we're doing is making sure that when somebody who is being discharged, if they're seeking to help themselves, we are providing them, as David Tinkis said, behavioral health, addiction, some severe and intense case management, as well as a workforce development option. And so we know that with those core things, at least we can have these individuals as stable as we can possibly get them should they work the program in a way in which we hope that they will and or anticipate. The other thing that we don't have control over is probation parole. We don't have any control over the laws. We don't have control over whether or not they pay their child support, although we highly encourage them. And so most people are reincarcerated based on parole and technical violations. And oftentimes that is the law. And so our program is not aimed to change that law, but hopefully we will be able to work with those individuals so they can be functional and productive within existing law.
So, in giving them an opportunity to help themselves, whether it's behavioral health that they need, or even, especially if someone's been incarcerated for a good amount of time, then they haven't been, they don't have they may not have the financial tools or backing, so they will need that workforce training. What is this going to cost them? So they don't have money to pay for these services getting out, coming straight out of from jail or from prison. So, what will this cost them if they're interested, or if this is something that they feel that they could take advantage of or benefit from?
It would cost them nothing other than their time and their commitment. We saw it as a need, and as a consequence, we sought to do something about it, this complex web. And we enlisted the help and assistance of Goodwill because of their history and our prior relationship with them when they are helping us with our SOULS program, which is a workforce program. And they have experience doing intensive case management with this population. So it was a natural collaborative get-together, if you will. And so I know that David Tinkis and his team members are passionate about this work, and certainly we are at Northeast Delta because, again, we see ourselves as catalysts, and we want to do things that really moves the needle around these complex issues and challenges. And so we just believe that as a pilot, and I want the listening audience to understand that this is a pilot because we want to test some things. We want to hone this right. And once we get this model right, we believe that there will be implications for how the state can properly deal with persons with mental illness and or addiction to hopefully alleviate them from going to jails or prisons, but be assigned more to outpatient treatment facilities and or inpatient treatment facilities, utilizing a holistic approach to help people stay in communities as opposed to going to jail and or prison.
So there's no cost associated for those who are interested in Laurie. What's the eligibility criteria? If someone's listening and they may have a loved one who may be currently incarcerated and they feel that they may benefit from these services, how can they become a part, or how do they reach out? How do they start the process?
The eligibility criteria is they must be adults, so 18 and up. They are to be considered medium to high risk for offending. So, we're not looking. Goodwill always has a policy of we want to help the people that are the hardest. Oftentimes, are the most challenging to help because that's what really moves the needle. And so, medium to high risk for reoffending. They do need to be housed at the Watchtower Correctional Center in Monroe, or returning to the area. We also look for people who will need to have a mental health or addiction issue, and again, we're looking to be able to start working with them, 90 days prior to release. And so, if it's shorter than that, it's going to be a little more challenging. We really to be effective in helping someone, we need to have some of that time to work with them while they're still incarcerated. But if they're interested, if loved ones know, that their person is being released, they can contact us at Goodwill, and we can look at what we can do to help them out.
So the coverage area for Laurie right now is for those who are in the Washita Parish prison and or returning to the Washita area.
Correct.
Okay. All right. So those listening, if you do have loved ones or that is in the Washita area or returning to the Washita area and are in need of these services, then definitely Laurie is available for them as well. We, even from the governor and just from so many other on a federal level, and we see so many reentry programs that are out and they're starting to scale back. Why? What's different about Laurie, or why Laurie at this time?
I think there's a couple things. There is, at the state level, there is an initiative to really address, our prison system and our probation and parole system in general, and we're very happy about that. It's a very good thing for our state, and so there's a lot of good things that are happening. At the same time, one of the things that we love about working with Northeast Delta is, in our line of work, we talk a lot about, there's a lot of ideas and we talk about a lot of things. And the thing that is always exciting to us is that Northeast Delta is action-oriented. It's not just talk about it, but, it's kind of like be about it. And so Northeast Delta is a natural partner for us. And so as we, started, discussing, what other, programs we could do together, the reentry issue is very, high profile right now. And as we discussed it, it's like, what can we do now? And there's other great things that are happening at all different levels, but what can we do? And so in partnering, we identified that the Laurie program, that why don't we just start doing it now? Why don't we use the services we have available and start putting this together for our community and to serve the people that need services? And so it was really just a matter of us deciding something has to be done, and by piloting it, we'll figure out what works well and what doesn't, and we'll get better at it. And the best part is people are going to get served. The whole idea that we can help somebody reestablish themselves in the community so that they don't return to prison, it benefits everybody in the community. It's a ripple effect. The person gets helped, of course, but their family gets helped, and the community benefits by all those things. And rather than waiting for somebody to tell us to do it, we decided it's important to us, so let's get it done. And so this partnership, the vision that Dr. Sizer has for the community is one that Goodwill shares. And so it's really a natural partnership, and it's one in which people are going to get helped. And really, this is just the beginning.
And I would agree wholeheartedly with everything Mr. Tinkis identified. But I also like to add this. Also at the state level, the state is dealing with a lot of budget-related decisions that they have to make. And oftentimes when you have a budget deficit, you have to make tough decisions in terms of where monies will be reduced from. And certainly, as you know, healthcare and mental health services and addiction services, many of those services have been put on the chopping block. And so as we seek to expand community capacity to help individuals with mental illness and or addiction coming out of jails and prisons, we're also forced with limited capacity in communities. So if there's limited capacities to receive a referral based on our model, then you can see there will be a referral made but no treatment obtained because of the limited resource availability to be able to deal with volumes associated with this population. Also at the same time, there are also impacts at the school level. There are impacts impacts at the Department of Corrections. There have been discussions about rolling some of the reforms backwards. And so as we are rolling out this pilot, I want the community to also understand we intend to be successful with this pilot. There will be some things that we learn, but we cannot be as successful as we want to be if the other systems and the other capacities are not there for us to work with. And so this is a holistic set of issues and challenges which will require a holistic approach if we are going to adequately address this as a state and as a nation and as a world.
So, for those listening, the LARI program is a pilot program that positively impacts the lives of those living with mental illness and addiction that's being released back into Washita area communities from Louisiana prisons and jails. This initiative is also in partnership with Goodwill of North Louisiana. And it's basically the model and the concept is that the individual is paired with a case manager 3 months out, about 90 days prior to their release. And that way they're able to be set up with behavioral health services as well as workforce opportunities that they'll be able to receive outside of once they return back into society.
Let me also add to that right quick, Terry, if I can. In addition to that, they'll also take advantage of every other opportunity in our network that we've established as an agency or authority. For example, we've established primary healthcare relationship with FQHCs, federal health qualified organizations, and rural health clinics. And so therefore, if people in this program are identified as also having a physical ailment, then we will make a proper referral to our relationships that we've established because we have an integrated care model. If they also need tobacco cessation, then we'll provide that. If they also need gambling treatment, we'll also provide that. If they also need more inpatient types of services, then we'll also provide that. David Tinkis and his organization will also do a community assessment where they also identify gaps in services, and we will be working collectively to figure out how we step in the breach in those gaps and resolve that. He will also and his team will be making proper referrals to various individuals based on their needs, because a lot of these folks will have issues of their clothes will either be too big or too small when they come out of jail. Transportation will be another issue, a major hurdle to this, because they got to get to and from work. And there's only one bus system in this region, and that's in Washita Parish. So you can imagine transportation could be a hurdle for some of these individuals. And you can also imagine that having sufficient jobs and people willing to give these individuals a second chance could be a challenge. But we don't let that stop us from trying to do something, because we know we will be successful with what we have. Our challenge is making sure that other entities in governmental sectors have sufficient capacity and a willingness to want to work across governmental lines to give these individuals the best possible options and hope and opportunities.
And in doing that, David, if you could give us a good website address for those who may want to reach out to you or for the LARI program, if you're interested in Northeast Delta Human Services Authority, for more information on this program, you can go to www.nedeltahsa.org. That's www.nedeltahsa.org. David?
Yes, our website is www.goodwillnla, like North Louisiana, .org, and our contact number for anybody that's interested is 318-868-4701.
That's 318-868-4701. And so final words from both David and Dr. Sizer as we wrap up.
Again, we are very excited about this. We're passionate about helping people, and this is so important to our community. It's such a problem when we have, a 44% recidivism rate. We want to drastically, reduce that. And I think, the other part is we love, having a great partner like Northeast Delta. We can't do it by ourselves. No organization can do it by themselves. And so the idea of really, collaborating and building a strong coalition, in our area, in our community to help people and make our community better. It's just we're excited about it because we know it's going to do some great things, and we're very grateful for our partner.
And I'll just add, we have a moral, a physical, and a spiritual obligation to give people hope and opportunities should they desire it in our state.
And on that note, that's Laurie. If you're interested in more information, you can go to www.indydeltahsa.org or goodwillnla.org or call Goodwill at 318-868-4701. That's 318-868-4701. And just another thing that Northeast Delta has going on in partnership with so many others in and around the area, National Prescription Take Back Day. It's where you can turn in your unused or expired medication for safe disposal. So any prescriptions that you have that's just sitting around in the cabinets, they can be a danger to yourself as well as those you love. You definitely don't want those falling in the wrong hands or in the hands of the children. So you can bring those medications and just drop them off for safe disposal. That's tomorrow from 10 a.m. to 2 p.m. at Brookshire's and Super One location stores in Farmerville, Ruston, Bastrop, and select stores in both Monroe and West Monroe, as well as the Louisiana State Police Troop F headquarters here in Monroe, as well as the Monroe Police Department. They have a standing box that's always there, right there in the lobby, even after tomorrow from 10 to 2. If you miss this time, you can always go to the Monroe Police Department and drop off those unused prescriptions. No questions asked. You just simply open the take back box, insert your prescriptions, and you can leave. So that's National Prescription Take Back Day tomorrow from 10 a.m. to 2 p.m. And it has been another segment of It Is What It Is, the effects of incarceration on persons with addictive and mental disorders, as well as the Louisiana Reentry Program, where we had our special guest, President and CEO of Goodwill Industries North Louisiana, David Tinkis. If you are interested and you heard some things that you'd like to get a little more information and reach out to Northeast Delta Human Services Authority, again, that website is www.nedeltahsa.org. That's www.nedeltahsa.org. As well as for Goodwill, it's goodwillnla.org. That's goodwillnla.org. And that phone number there is 318-868-4701. 318-868-4701. It's been a great day on It Is What It Is. And I'll leave you with a quote today. The best project that you'll ever work on will be the project of yourself. It's Friday, April 27th, 2018, our last show for April 2018. Have a great Friday, everyone. It's been our pleasure. It is what it is.
You made me happy. This you can bear. You stood right beside me. Yeah. And I won't forget. And I really love you.
You've been listening to Northeast Delta Human Services Authority radio show, It Is What It Is, with Executive Director Dr. Monteg Sizer and Public Information Director Snail T. Terry, giving perspective on navigating the process of being and becoming your best self, because it is what it is.